The importance of maintaining physical activity in midlife, particularly between the ages of 45 and 65, cannot be overstated, especially when it comes to preventing Alzheimer's disease. The findings from a recent study by the Barcelona Institute for Global Health, IS Global, reinforce the profound link between exercise and brain health. The study highlights the significant role that increasing physical activity can play in reducing the risk of Alzheimer's, particularly among those with a family history of the disease. While it has long been known that exercise supports cardiovascular health and mental well-being, new research suggests that its benefits extend directly to the prevention of neurodegenerative diseases like Alzheimer's. This research is part of a broader scientific effort to understand how lifestyle choices, especially physical activity, can influence the onset of diseases such as Alzheimer's. According to the World Health Organization, WHO, engaging in at least 150 minutes of moderate-intensity physical activity per week, or 75 minutes of vigorous activity, is recommended for adults. Yet, despite these guidelines, many people fail to meet these recommendations, leading to an increased risk of physical and cognitive decline. In fact, it is estimated that around 13% of Alzheimer's cases globally can be attributed to a lack of physical activity. This statistic alone underscores the urgent need for interventions to promote physical activity among middle-aged individuals. The study, which followed 337 participants over 4 years, provides compelling evidence that increasing physical activity can reduce the accumulation of beta-amyloid, a protein that, when it accumulates in the brain, is considered one of the earliest pathological events in Alzheimer's disease. Participants who increased their physical activity to meet or exceed the recommended levels demonstrated a significantly lower accumulation of beta-amyloid in the brain compared to those who remained sedentary. This result is particularly striking as beta-amyloid buildup is one of the key factors believed to contribute to the development of Alzheimer's. Furthermore, the study found that the benefits of physical activity were dose-dependent. In other words, the more participants increased their activity, the more pronounced the reduction in beta-amyloid accumulation. For those who engaged in even modest amounts of physical activity, the results were still positive. These individuals showed thicker cortical regions of the brain, which are crucial for memory. A reduction in cortical thickness is a common early sign of neurodegeneration, which is why the finding that even minimal physical activity can prevent such changes is particularly significant. It suggests that any form of physical activity, no matter how small, can be beneficial in maintaining brain health. The study's findings reinforce the idea that promoting physical activity in midlife is a key strategy for the prevention of Alzheimer's. Increasing awareness about the importance of physical activity and making exercise more accessible to people in this age group could be a game changer in public health. With the growing number of individuals reaching older age and the increasing prevalence of Alzheimer's, encouraging physical activity has the potential to drastically reduce the incidence of this devastating disease in the future. One of the key takeaways from the study is that the benefits of physical activity may not necessarily depend on meeting a specific threshold of exercise, but rather on the consistent increase in activity over time. This offers a more achievable and sustainable approach to incorporating exercise into daily life. Even small, incremental increases in activity, such as walking more, taking the stairs instead of the elevator, or engaging in light stretching, can have a profound impact on brain health. It's important to remember that the brain, like the rest of the body, benefits greatly from regular physical exercise. For those in midlife, adopting a more active lifestyle not only helps preserve brain function but also contributes to overall well-being. The positive effects of physical activity extend beyond Alzheimer's prevention, improving cardiovascular health, mental health, and even reducing the risk of other age-related diseases. As we continue to learn more about the impact of exercise on the brain, the evidence increasingly supports the idea that staying active throughout life is one of the most effective ways to safeguard our health, both physically and cognitively. Ultimately, the results of this study should serve as a wake-up call for individuals in midlife to prioritize their physical health. The message is clear. It's never too late to start exercising, and the rewards for doing so extend far beyond just maintaining physical fitness. By incorporating more movement into our daily routines, We are not only enhancing our quality of life today, but also taking crucial steps toward preserving our mental and cognitive health in the future. The findings underscore the importance of public health initiatives that encourage physical activity, making it easier and more appealing for people to stay active as they age. In this way, we can work toward a future where Alzheimer's disease and other cognitive impairments are far less common, and where individuals can enjoy their later years with better health and vitality.